My name is Brooke Booher, and I'm going to talk about access to prenatal care. Maternal deaths in the U.S. are on the rise. Nearly 500 pregnancy-related deaths occur annually because the woman does not have prenatal care or she just lacks prenatal care. About one half of these deaths can be prevented if she receives proper prenatal care. And depending on her race and socioeconomic status, the rates could be higher both in maternal and infant mortality. Prenatal care is important because it allows the physician to monitor both the mother and the fetus, complete the appropriate screening tools, ensure that the immunizations and titers are up to date, provide nutrition and exercise education, educate on the benefits of breastfeeding, and to help prepare the woman for the life changes that she is going to experience. So prenatal care, a woman needs to have at least 8 contacts with the healthcare provider during her pregnancy. There are so many tests that are completed during the first trimester, which help to determine if there's a congenital defect, if it's viable, and if she is having any type of miscarriage. So the routine visits, she goes every 4 weeks until she's 28 weeks, then every 2 weeks until she's 36 weeks, and then weekly until she delivers. The visits may also need to be altered if she's got a chronic medical condition, if there's a new problem that develops, or if she's over the age of 35. So during the first trimester screening is when most of your tests are going to be completed, and it needs to be completed during the first 10 weeks of gestation. They need to have an ultrasound done to confirm the pregnancy, determine the approximate age, and the estimated date of delivery, as well as determine if there's a multiple gestation. There's also some genetic screening that can be completed if the woman desires it, if she's older than 35, or if there's a previous history. So the second and third trimester screening, you're going to have an anatomy scan completed at 20 weeks. You're going to do the glucose tolerance test at 28 weeks, a repeat H&H, a GBS screening between 35 and 37 weeks. The Tdap vaccine is administered between 28 and 35 weeks. She's going to receive the RhoGAM injection if she is Rh negative. And also, they need to be attending birthing classes, breastfeeding classes, and newborn classes during the third trimester. But at each visit, the woman is going to have a blood pressure check, urinalysis, measurement of weight, fundal height measurement, and fetal heart tones. So with late or no care, you've got your lowest rate is going to be your non-Hispanic white women, with your highest rate being your American Indians and Alaska Natives. So the population at risk for this is women in their teens, again, your American Indians and Alaska Natives, along with your non-Hispanic black women, with the lowest rate being your Asian, your Pacific Islanders, and your non-Hispanic white women. Also, women of minority and poor population are going to be at risk, women who do not have a high school education, or if they have a case of some type of mental disorder, as well as your immigrants and your migrants, whether they are legal or illegal. They're going to not receive prenatal care for several different reasons. So your contributing factors are going to be, your main reason is they don't have any health insurance. And listed below, depending on their immigration status, the fear of testing positive for HIV, testing positive for drugs, being ashamed or confused, a recent move, contemplating abortion, unaware of the pregnancy. Your immigrants are going to have a language barrier, which makes it difficult for them to communicate. They don't have transportation, no child care, and several other personal reasons. So your healthcare risk, your infants are going to be low birth weight. They also have a higher chance of having infant mortality with several different complications, such as SIDS, respiratory and GI complications. And if they are born prematurely, they have a greater risk of infant mortality. So the woman needs to seek care as soon as she finds out she's pregnant. And also it helps women get the care that they need, allows for a healthy pregnancy, healthy baby, and a healthy. So in conclusion, prenatal care increases healthy mothers, healthy infants, and healthy outcomes. And prenatal care is something that a pregnant woman should receive consistently throughout the entirety of her pregnancy. And all females, regardless of her race, ethnicity, skin color, economical background, deserves to become a mother and have a healthy pregnancy and a healthy child. And here are a list of my references. Thank you for listening to my presentation.